So Nori, your eyes look great. You feel incredibly well. We're at approximately wide open, a 1 month visit. You can sit back. So you are doing quite well.
Yes.
We are about 1 month out, a little less than, maybe just a little more than 1 month out.
Okay.
Your vision's around 20/20. So, and you know you're doing well.
Yes, absolutely.
So we're going to now start decreasing the steroid drops.
Okay.
And we're going to weaken the steroid drops to 1/8 strength, because we don't want you to be on steroids any longer than you need to be. We need the steroids still because we want to prevent any haze from forming after PRK, even though nowadays with the advanced lasers that we use that are very smooth and fast, dramatically decreases the chances of any haze. The steroids are still helpful, so that becomes very rare that we have to worry about any significant haze that happens after a procedure. And that's why I watch you also, to modulate the steroid drops. You've already healed the first layer of epithelium that is microns in size, and there'll be multiple layers that are healing. So 1 month, you probably healed layers 1 and 2, maybe not layer 3 yet, and they're not perfect. So the body is still polishing them, and the body will naturally polish them with lubrications and just tincture of time. But you will probably keep improving, although it's like watching grass grow over the next 3, 6, even 9 months. You're more than functional, you already know that, but there's actually more to come. Fluctuations in vision are normal at this point, because the tear film is not totally normal. Part of that reason is because the nerves that modulate lubrication are affected by doing a laser treatment, and so they take a while to come back. You're not dry at all at this point of time, but I wouldn't be surprised if you do notice some fluctuations. Actually, everybody fluctuates way before you had laser, because whether it's illumination and your pupil size changing, or different colors, people actually change their vision during the day, but they're used to it. So now people after laser vision correction are more attuned to changes, and you kind of sometimes have to tell yourself, this is normal. So you always were blurrier at night. You're not complaining of that, but I always remind people that that is actually a normal thing for people to be a little blurrier at night, because when your pupils naturally dilate, more peripheral light rays come into your eye, and you become a little more nearsighted. That always happened. You're just lucky you're not having any of that. But I just want to remind you some of the things that are normal. If you have any questions going forward, you always have the number to call here, or to call my cell phone. But I expect no problems. We're going to be doing this tapering of this weak steroid over the next few weeks. We usually do that over a 6 to 9 week period. And your pressure is normal. We always check that because a certain percentage of people's pressures are elevated when using steroid. So that's one of the things with yours is perfect.
Okay.
So you're in the home run territory. Only one thing I would tell you to do, I'd like you to continue your vitamin C, which we think is helpful with collagen formation, which is occurring in your cornea after laser vision correction. And we want you to use in bright sun UV sunglasses. Good, because the UV can cause, has the potential to cause some haze on the cornea. So when it's bright, certainly the first 6 months, we want you to keep using it. Although I tell patients always to use UV glasses to protect them from cataracts and macular degeneration. But in the healing period of laser vision correction for PRK, UV glasses is important.
Perfect. Sure. Thank you very much.